Joining us live, Dr. Kevin Mose, coming back from his week at the BMW. Man, what a great tournament that was.
Steve, it really was. Not only was it great TV to watch, anybody who was out there, we had great crowds, but a great winner. I mean, how about that kid? Just not only that he shoots a 61 for the course record, but, man, I'll tell you, I saw him all week. I think he smiles like 99% of the time.
It's nice to hear.
He has a great outlook. And, seeing him behind the scenes, seeing him in player dining, he is polite to everyone, polite to the staff. Some guys, it's like, oh, hey, that's your job, and they're just not even there. He was saying good morning. He's really a class act and quite a player.
Victor Hovland. Keep that name in mind. He's going to be around for a long time.
Ryder Cup. Yep.
Yeah. Unfortunately, the European team looks really strong. But nice job by you as well, and always keeping the folks to raise money for the Caddy scholarships.
The Evans Scholars.
The Evans Scholars to out front, because the Evans Scholars made a lot of money this weekend.
Mm-hmm.
Yeah, they really did, and just some really good exposure. It was great that this is the first year they actually had something very interesting off the ninth green. They had something called the Loopers Lounge, and if you were an Evans Scholar alumni, we had the entire skybox to ourselves.
Oh.
So it was amazing just seeing kids you went to school with, kids that are in school now, and it was great. And I'll tell you, like you said, a lot of exposure, a lot of money raised. They're going to send a ton of kids to school, and these are deserving kids who have financial need, who have good character, you're talking about the cream of the crop. When you're talking about a 97% graduation rate, these guys know how to pick the right kids, and they're very deserving.
So caddy, and get your kids caddying.
Yeah, I mean, it's a great job. I mean, I've had a few jobs, fortunately only one for the last 30 years, but it was the best job I ever had. You learn how to talk to adults. You learn how to manage money. You learn the importance of when that alarm goes off, you don't hit snooze. You get up and you go to work. And, these are, 12, 13, 14-year-old kids. So it teaches you a lot, gives you a good opportunity to meet other kids that you wouldn't have met, make a little bit of money, and, hey, if you work hard enough, who knows, it'll pay for your college.
Yep.
Dr. Kevin Mose, Northwestern Medicine, Central DuPage Hospital. Where do we begin today?
We haven't talked about COVID in a while, and there's just a couple things coming up. There's a new strain of COVID that's going around that people should probably be aware of, because we're starting to see more patients in the hospital and certainly starting to see more cases in the community. And then really the biggest thing is going to be, the new vaccine that will be out here shortly. People are going to be confused and saying, okay, what do I do now? And just kind of wanted to make sure everybody was on a level playing field as far as what the expectations would be for the vaccine's status this fall.
Question.
So you tell me where you want to go first.
So I've had, Dr. Mose, 2 friends in the past month or so get it. One is over it. One was battling it last week. This is all via text, so it wasn't in person. But they said they caught it. What should they do once you get it? I know it's not as bad as it once was or when it first came out, but with the new variant, is it just take the Advil, take, the over-the-counters to get rid of the symptoms?
Yeah, Audrey, it is. The nice thing about it is the symptoms are pretty much the same. You still have the fever, cough, the sore throat, the fatigue, but it's much more contagious. So a lot of people right now that are getting it, they're saying, is this my fall allergies kicking in, or is this just a cold? So a lot of people aren't even being tested. Those that are being tested, whereas doctors were saying, okay, are we going to use Paxlovid? We're going to look at these patients and say, what's our risk reward here? Are they immunocompromised at all? Do we have any concerns about heart disease or COPD? And we're going to treat those patients. But others are doing pretty well. It's lasting a little bit longer, going about 6-7 days. But for most people, it's going to be pretty much self-sustaining. Take fluids, Advil, Tylenol, and get some rest. But know you're very contagious.
This EG5, Eris, as it's called, I guess, who would get the vaccine first? Is it going to be rolled out like the old COVIDs were?
Well, yeah, this is going to be really interesting because the strain that we're seeing right now that should be the predominant strain here, it probably already is, we just don't have enough testing, is like you said, this EG5 or Eris. But what we're seeing now is the vaccine that has been approved that's going to be released in September is based on the XBB variant, which was the variant all through the spring and through the summer. That's why we built the vaccine that way, and that's why we're using that. The Eris, they say, well, wait, you just told me the XBB is the vaccine, but now there's the Eris. Eris is a variant of XBB, so the vaccine should be extremely protective of this new variant. So very lucky that we're going to have a vaccine that lines up very well with the current strain that's out there and hopefully protect a lot of kids as well as adults.
So will this be another year of get the flu shot and get the vaccine?
Yeah, it's going to be released at the end of September, which, a lot of us were a little bit concerned about because we knew that this bump was coming in the late summer, like we're seeing right now and we have seen for the past couple of years. But with it not being released till September, now you're right into October, which is when you're going to get your flu shot. So we're saying get them both at the same time. It's fine to get them both at the same time, and it will be available right here at the end of September, beginning of October.
But insurance may not cover it.
Insurance, some insurances will definitely cover it, and I think you're going to find out that almost all of them will. Certainly Medicaid, Medicare will cover these. The insurance companies have to realize that, the investment in the shot is worth well more than the aggravation and the cost that they're going to have going to an emergency room or going to an urgent care. But you're right, the government no longer is footing the bill for this. It has now been pushed on to the insurance companies.
And we look forward to you coming in and giving Andrea a flu shot.
Well, I think she's probably going to end up going to Scotland, or she's going to be on.
No, I'm an old pro now. Ever since that first shot and you alleviated all my fears, I'm a regular
I just
now.
remember looking on Dr. Mo's face when you went, I don't think I can have it. I have to fly.
Well, that's when I was scared to get shots. Now I'm completely over that now.
Dr. Mo's had this look on his face like, yeah, we didn't cover that in medical school.
Yeah,
that whole flying and you can't get a shot thing.
It wasn't part of the Hippocratic Oath.
Yeah. I think she actually started she goes, I have to take a bus home, and I'm like, no, but then I'm going on an airplane to Milwaukee, and then all of a sudden, she's on her way to Scotland.
Yeah. Somehow she survived.
Yeah.
Get the shot when you can, and no, we're not going to continue to have the you should or shouldn't, and vaccines cause all terrible things in the world, and Bill Gates is tracing you. We're not going down that road. Dr. Kevin Most rejoins us. Dr. Most, always good to have you, and the Senior Vice President of Medical Affairs, Chief Medical Officer, Northwestern Medicine Central DuPage Hospital. And there's a texter with a good question, Andrea.
Yeah, text line's blowing up for the doctor. I have COVID now. Do I have to wait 3 months to get the booster in the fall?
No. No, you'll be able to, the beauty of it is you are going to have some really good natural immunity against the circulating strain right now. But you'll be able to get the booster. I would wait probably a good 30 days, if not 40 days, before I got it. But know that your natural immunity is going to be for the specific strain that's going around right now. And the booster that you're going to get is actually the strain that was one before. So you're still in a very good position. So you might want to wait till closer to Thanksgiving, but certainly it'll be available to you.
We were talking off the air before you came on about the fact that it's going to be years before we understand the full impact of COVID, whether it's shutting down schools and the kids' learning gap and how it affected relationships and things like that, let alone the health issues. When it comes to the health issues, there's got to be a dribble effect, right, on other illnesses?
There is, and it's kind of interesting, Steve, the way you just set that up. If you look at what happened last year, remember the triple-demic, we had RSV, influenza, and COVID all hitting, and we normally wouldn't think about that. Influenza was something that's going to happen normally. RSV is kind of an afterthought, but because these kids and a lot of adults hadn't been exposed to anybody, we had that triple-demic, and that all hits. Why did that hit? Because of how we acted during COVID. Well, if you take a step back and say, gosh, something as simple as an upper respiratory infection, how did it impact other things? We normally would identify, 70,000 cancers, right? Well, during COVID, think about it. You didn't get into the dermatologist. You didn't get in for your colonoscopy. You didn't get in for your mammogram. So what we saw is the number of cancer cases, initial cancer cases, drop dramatically. Cancer didn't go away. We just didn't have the screening opportunities. So what we're doing now is people are easing back in, like you're having your colonoscopy on Thursday. We're easing back into getting the screening done. Unfortunately, we're finding more people with advanced cancer that missed the opportunity during the screening time of COVID, and now we're dealing with the repercussions of that.
Are you finding other lingering side effects, too, that you didn't think you might have found immediately, Dr. Most? So not just like the fatigue and the asthma, but maybe stomach problems or things of that nature?
Yeah, Andrea, it's really interesting. The NIH the NIH got together and said, you guys, we have this fragmented system right now of reporting of what's going on with COVID patients. So they set up a bunch of really good studies that looked at patients at 3 months, 6 months, 9 months, 12 months. And what they found was absolutely fascinating. The vast majority of people after 3 months, the symptoms are pretty much gone. But what they also found that individuals even 9 months after that, so 3 months of COVID, 9 months after that, now they're getting symptoms of long COVID that they're putting back right to the initial COVID infection. So we talk about individuals getting long COVID. It certainly happens right off the bat and just continues. But what they're seeing now, because they're starting to track it, is people had COVID, got better, and now 6 months later, 9 months later, are getting the symptoms of long COVID, whether it's cognitive, loss of taste or smell, some pulmonary or heart issues. So very interesting how this sneaky little virus not only is impacting us now, but potentially in the long term after we've healed.
So there's no specific treatment for long COVID, right?
Well, it's interesting, Steve. When we say long COVID, it's almost like saying I have cancer. And I don't want to equate the two together.
No, I understand. No, it's one of those things that people are living with, right?
Well, not only that, it's a very generic term, right? Cancer. You can have colon cancer, you can have breast cancer, you can have skin cancer. Same with COVID, right? Individuals who have long COVID, it may be that they have cognitive issues, that they're sluggish in the morning, that they feel fatigued. It could be that their breathing is bad. It could be. So we have this wide spectrum of what long COVID is. Individuals who still can't, have taste or smell. So when we say, is there a treatment for long COVID, we're really starting to look at the individual aspects of the symptoms and saying, what are we going to do for the individuals who have cognitive? What are we going to do for the individuals who have heart issues? What are we going to do? So just like cancer, where we have specific treatments for the specific areas of the body where it occurs, we're going to find the same where we're looking for treatment options based on which symptoms you have.
We're going to run out of time quickly here, but before we do, Andrea wanted to bring up something that everybody's dealing with this week. Yeah,
well, obviously the extreme heat, we could be setting records on Wednesday and Thursday, Dr. Most. So obviously stay hydrated, try and stay inside if you can, the air conditioning, or maybe find a pool.
Exactly. And Andrea, I think, probably one of the most important things is you guys, when you look at the heat, don't even look at you can look at the temperature, you can look at the feels like temperature, but also look at that dew point and that humidity index, because that's how we cool our body. And when it's as humid as it is, our cooling system doesn't work. So the sweat that we have on our body that normally evaporates, that cools us off, isn't going to evaporate because we're so high. The fortunate thing is we're going to have some decent breezes, so that will help dry the moisture and will cool the body a little bit. But everybody needs to be extremely careful over these next couple of days.
Yeah. Good luck to everybody that is dealing with any after effects of COVID. I played in a tournament last week, golf tournament last week, and I was at the BMW. I didn't make the cut. But no, I played in a tournament. There was a guy there who's a great guy. And I could tell he had portable oxygen with him. Well, he's dealing with long COVID. Mm-hmm. He's out there playing golf, which is great.
Yeah.
Dr. Most through the years has introduced me to a bunch of great doctors, and I've met other great doctors because I met those doctors. So I had a Dr. Hewlett this morning. What a good guy he is.
Hey, Kevin is a great guy, and anybody who's had a patient with him is just fantastic. He's just a fantastic doctor, and it's funny you bring him up. Corey Hugg, who's one of the trainers for the PGA Tour, he travels with the PGA Tour. His little daughter need to have her adenoids out, so I was up visiting them before surgery, and Kevin walks in and he looks at me. He's like, "What are you doing here?" It's like surprise. And he goes, "How do you know Corey?" Yeah, Kevin is a great doc and a wonderful person and really a very talented surgeon.
Great to have you on as always, Dr. Kevin Most. Thank you for the update.
You got it, guys. We'll talk soon.
There you go. And again, Senior Vice President, Medical Affairs, Chief Medical Officer, Northwestern Medicine, Big Kahuna.
The best.
And he's coming in to shoot Andrea. Inject Andrea.
Inject me.
Yeah. Yeah, it came out really wrong.
Speaking of the news.